Good afternoon, everybody. Thank you so much for your patience just while we had a few little technical issues and we, had another opportunity to get some fresh air. I am delighted to welcome you all here today. Thank you for bearing until the end of the day, but we're celebrating Health Day today, and we wanted to welcome you from Wellcome and the Global Climate and Health Alliance today to hear from a wonderful panel about NDC implementation and how health can support that. As of today, and this is live, as Anna Tony has just confirmed, 114 NDCs have been submitted, which is quite a record given where we were just before COP. But as we know, that is great. But sitting here at COP30, the global community is actually entering this divisive period where we're shifting from commitment now to implementation. So NDCs as being a country's pledge to act on climate action, for the health community, there is a shared opportunity here to integrate health, equity, and resilience into these climate actions. And health really offers a unique lens linking human well-being, resilience, and public engagement together with climate ambition. And NDCs really must be this living strategy. The health community, as all of us, can really help bridge some of that science and society and really linking climate ambition into creating healthier and more resilient lives for us all. So that said, we've got a great panel from WHO, from Guatemala, and from the UK itself. So I'm going to launch straight in with some questions to the panel, and we will have an opportunity to have a short Q&A as well. And finally, some remarks from Jenny Miller from GCHA. So I'm going to start with you, Ventura. Just as a bit of a bio, Ventura leads the work at UNFCCC on NDCs. He's been with the Secretariat now for 17 years, leading the UNFCCC regional collaboration centres, supporting countries with implementation of climate action in Africa, Latin America, and the Caribbean. Now, your question is, the UNFCCC obviously has recently published its latest NDC synthesis report. Can you tell us about where things are currently standing in terms of ambition, but also the implications for health and what is needed now as we move into this implementation phase?
Sure. Thank you, Aarti, and also thanks to Wellcome Trust and the Alliance for Climate and Health for this discussion panel. I think going back to the synthesis report, I say that because you mentioned that already there's 114 NDCs that are out. The synthesis report has only 64 NDCs that were submitted as of end of September this year. So you see a big jump from that number to now. And I believe this is 114 parties, because there was the EU submission, which did cover a lot of the NDCs from the 27 members as well. But at the time of the NDCs, if I just mentioned the health sector references, so there were around 96 NDCs that had health, that had actually adaptation component in the NDC. So not all NDCs do cover adaptation, because by design, of course, it is left to the countries, but the countries do decide to see whether they would prioritize mitigation in their NDCs and have national adaptation plans, or the NAPs that would focus on adaptation, or sometimes they would have a combination of both or reference to the NAP in the NDC. So there were 96% of those 64 NDCs that we use in the synthesis report had references to adaptation, and 73, and 96 of that NDCs on adaptation actually had references to health as a key sector that they would work on. But in context of implementation, I want to bring a different angle. Well, I come from mitigation, part of the Secretariat, although I lead the work on the NDCs as well. And in that biasness, I believe health plays a key sector in motivating the implementations in the mitigation sector, because most of the NDCs has targets in reduction of fossil fuels, transition to renewable energies, reduction of emissions in general, which has a core benefit in the health sector. And I believe the challenge there is how that is being reflected as an impact on the health sector, how it is accounted for, how that impact is calculated, quantified, and then translated into the savings on the health sector. That is important. That would encourage actually more engagement from the health sector in the design and implementation of the NDCs. So it is important about this coherence, which is an important message, a core benefit that is really also set to encourage countries to start investing in NDCs, because it is also having benefits in actually in the savings in the health sector that are linked with the respiratory, the air quality related factors. I believe WHO had played a key role, and I was involved in some of the work from PAHO in the Caribbean when I was there. And we see that it is important to reflect this, and that buy-in that you get from the society as a whole and the other sectors. You're seeing if you quantify it into the amount of savings, that this is an important encouragement for the implementation of NDCs. When it comes to the scope itself is a landmark where we emphasize more on the need for accelerate the implementation, because we are almost there when we say about the 2030 targets. This is like the last round of NDCs, and this round of NDCs have 2030 targets plus 2035 targets, but we are now, if we don't implement these, now in 2030 we will have the next round of NDCs. So the countries will be discouraged when you are asking to develop a new NDC if the implementation is not also equally ambitious. So we hope that a lot of effort needs to be done. We are already behind in this. So we hope that we can work together in accelerating implementation, both, of course, from the country side, but also the support that will be required in terms of finance, technology, means of, and adaptation, and capacity building that would be required for the accelerating of this implementation. And this is, we believe a lot of the partners like WHO, the whole of the UN system, by NDC partnership and other partners, as well as the multilateral development banks and other financial institutions, will be critical partners in achieving these targets. So with that, I would like to hand it back over to you, Aarti.
Excellent. Thank you very much. And thank you for creating that sense of urgency, but also the need and the importance of collaboration at all levels, but certainly how the multilateral system can work together to ensure that the implementation phase now has the ambition that we need to see. So I'd like to move over to Elena now from WHO. So Elena is leading the WHO-led Alliance for Transformative Action on Climate Change and Health, also known as ATTACH, and work related to capacity building and country support. So building on something that Ventura said, often we hear those that want to undermine climate action often focus on the economics and claim that it's actually too expensive. So can you tell us about actually the urgency and the vital, the sort of the pressing nature of ensuring that climate action and the narrative around climate action, that it's costing more money, but actually it's costing us in terms of health as well, and the cost to society of those health impacts?
Thank you very much for the question. And I have a good news for you. Ventura said everything that I wanted to say, so I will be short. But I was really happy to hear those messages from Ventura, because I think they are much more powerful coming from him than coming from WHO. And basically, the lines of our intervention is the same. I think that in 2022, there was some data coming out that was quite striking for WHO. So basically, as you know, in 2022, there was a crisis in the price of energy, and basically the G20 countries increased their investments, their subsidies to fossil fuels, basically, with a total of over $1 trillion US. And this is a study by the IISD, International Institute for Sustainable Development. But then at the same time, the same year, IMF, International Monetary Fund, also released an assessment by which basically they estimated that if you count on those subsidies to fossil fuels, you count the externalities, health plus others, the real amount of subsidies is not 1.4 trillion, is 7 trillion US dollar. And the good news is that they also estimated that if you basically put a realistic price that counts health and the other externalities in the price of fossil fuels, basically you will reduce by 50% the deaths linked to air pollution. You will bring down the emissions by over 25%, and you could raise $3 trillion basically on revenues. So with this in mind, then we managed in WHO to look at the investment case. In WHO, as you probably know, climate change is now one of the 6 priorities that WHO has for the next work program. And basically, we assess how much we could gain in terms of economic benefits, but also lives saved, if we implemented 5 proven interventions on climate change and health. So those interventions are electrification of primary healthcare facilities, water, sanitation, and hygiene for adaptation, then putting a price basically to fossil fuels that includes health and all of the externalities, heat health warning systems across the globe, and then cleaner household energy sources. So basically, if those 5 interventions are implemented, and those are just 5 for which we have data, we could save almost 2 million people deaths basically per year. And again, this is just limited to 5 interventions. Something else that I think is important, we also released together with WMO a technical document on heat and workplaces. And basically, we assess, and there is data showing that for every increase in temperature, increase in 1 degree centigrade in temperature, there is a reduction between 2 and 3% in productivity by workers. This is real loss for countries, and this is real money that then we need to compensate basically with additional investments to treat those that are ill.
Thank you. Thanks very much. And you really demonstrated some of the economic gains of climate policies that protect health. I'd now like to move to Andrea for her experience as a Guatemalan climate leader and policy expert with over a decade of experience in international environmental governance. She currently serves as the Director of Climate Change at the Ministry of Environment and Natural Resources of Guatemala. Now, I'm keen to understand more about your NDC and the process. So Guatemala's NDC integrates health on so many levels. What was the rationale for including health considerations into the NDC development and now into implementation? And how did working across government aid you in doing that?
Well, thank you very much for your questions. I have to say I like the questions because this is something we've been dealing with the whole year, so it's nice to talk about it a little bit. Very happy to be here. So to give you context to begin with, our NDC, our last NDC, or second NDC, didn't have much on health. We did have a roadmap that was worked through cooperation and a lot of work, but still, because of our vulnerabilities in the country, health is a sector that is more much of a reaction rather than a prevention. So that actually reflected on the NDC 2.0 because we didn't have like much goals or standards on that. So coming from that, while we were thinking on the process for the NDC 3.0, we realized that we needed to click it with our national plan, which is like our NAP, but in a bigger scale, because we wanted to work mitigation and adaptation not separately, but realize how they interact. And we made this a process in long-term and short-term. So the NDC became our short-term process, and the National Plan for Climate Change became our long-term process. So they're both, we started both processes in parallel, and then we are going to finish NDC at the end of this year, hopefully, and then we continue on the same basis for the plan for the next 6 months next year. So saying that, the process with health was very interesting because when we did the 2.0, the NDC 2.0, the Ministry of Health didn't have much resources or information to work on. Luckily, we found this time, very, very happily, we found that they have been working on some data, but it was very crucial for us to work together because we needed to do that interaction and guide them through climate change, and we needed their expertise through health. So that worked really well. We started working with different workshops. I'm happy to say we had a lot of participants in those workshops, including the health sector, and we had also participants from the Red Cross, and that gave us much more information that we needed. And what we had was this methodology using different kinds of data, included maps like geospatial, and we realized that we could do these different shapes and see access to hospitals or health centers, how long they were from the communities, if there was a highway in the community or not. And all of those factors came into this vulnerability maps that show us the gaps for health, which departments or states in my country have more vulnerabilities concerning health and concerning the access to health facilities. And there were 4 of them, mostly in the west part and the north of the country, because the population there is like very spread out. So health centers are very spread out too, and they don't really get that much access. We had that, and we also had different varieties from the highways, mostly. We realized that was something that had to be connected. So that was something interesting too during our workshops, because we got to have the health people sitting down next with the infrastructure people, because they need to realize the connection. And infrastructure was another of the sectors in our NDC that really had nothing in the 2.0 version, because again, they see things like emergencies or something that to be like reaction and not prevention. So this was really interesting to see how they connected. And for us working in climate change, that was like very clear, like you make that connection. But interesting enough, people in health and infrastructure don't see it that way, or didn't see it that way, because that changed due to this interaction that we had. And then we developed this vulnerability index for the social vulnerability index that included the health part. So that was very interesting because that gave us like a lot of data. Sorry, maybe it's my phone. No, sorry. So we took the poverty maps and we took the census from the country and the numbers for mortality and disease in the country. And we developed this index that gave us even more data to set up some goals for our NDC and a better analysis rather than just a roadmap, which is what we used to have. And we realized what seemed obvious, but now we have numbers to really back it up, that we need to make our health services network larger, obviously more access for people. The little health centers that are just like little stands in the middle of nowhere need to be, need equipment and need human resources to attend them. So that was like pretty obvious, but still we didn't have like those numbers. So now that's on our NDC. So that's great, because now we get to actually work on that. And going back into the process that I explained at the beginning, how we managed to work together with our national plan, the idea and the whole thing behind it is because we want to make sure that the national plan gets budget. And the idea behind it is that all of the ministries, including the health ministry, need to have their actions in climate change reflected on their budget. And we're going to do that through the national plan. So that's why we did that general process. So looking at the numbers and our results and all of this data from health, we hope, we expect that through NDC 3.0, we're going to get that budget in the next, in 2028 would be. And so we would be reflected still on this term of government, let's say. And finally, I guess I'll just jump a little into the goals that the three main actions that we are getting on health for our NDC. First, we're going to have an integration of the information on the health system and climate change to generate our baseline to have a better decision taking in what's related to any disease that is sensible to climate. Mm-hmm. We also have doing a regular check on the index that we developed for development for the social vulnerabilities. So the idea is to have that on for 2030, we're going to have 100% of the data collected through that index. And then the next one that we have is to have at least for 2030, 70% of the hospitals having plans regarding the diseases that are reactive to climate. Mm-hmm. So those are like the main ones that we had. And also, we're going to include in our NDC 3.0 early alert systems that are regarding health issues too, but these are going to be connected with the infrastructure one. So the risk management is going to be transversal, and it will include health. So it's a lot of it's a lot of work, and it was a lot of information. We have maps, index, a lot of data, and we came into these three actions that seem very simple, but yet they have all of this information behind. And like I said before, I think they seemed obvious at the beginning because we can see how our hospitals, our people are doing, but still you needed to back it up with those data, with information, so now we can actually have it reflected on our NDC and then on our national plan, and then like I said before, that will be our instrument and our way to push into the budget. So we make sure that it's not just another wish list from our NDC, but something that is actually going to happen and that will have an impact on the people, especially the vulnerable communities in those 4 departments that I mentioned. And I guess I'll keep it short and sweet. And yeah, that's our experience. Thank you very much.
Thank you so much, Andrea, and thank you. It's really great to understand the evolution. To really understand the evolution and how much learning you've really taken from NDC 2.0 to ensure not just with a solid science foundation base and data and attributable data, but how actually important that's been in the next step now of translating into investment cases. It's a very powerful argument. So I'd now like to move to the UK to Anna Walters, who is the Head of Climate Strategy and Diplomacy in the Foreign Commonwealth and Development Office, FCDO. She has worked internationally in her senior diplomatic career and policy career across the Middle East, Africa, and Asia. Now, Anna, I would like to ask you about UK was one of the first movers ahead of COP29 with the submission of the NDCs and has really positioned itself as a leader in NDC ambition. But ambition in itself is great, and it's now this phase into moving into implementation. So delivery being the key, the real test here. So do you think sort of a more people-centered, human health-centered approach to implementation is essential for building that political and public support and bringing the electorate with you?
Thank you. Can you hear me? Yes, I can hear myself. Good. Great. All right. Thank you so much for inviting the UK onto this panel, and it's been hugely interesting actually to hear all the other panelists so far. Some very inspiring information. It's so great to hear the number of NDCs we're now at. Really interesting to hear the sort of economic benefits of health and some of the figures on that. And then the Guatemala example was, I think we can all learn from it actually. There was some really interesting content in what you said, so thank you. For the UK, yes, we have set high ambition on NDCs, as you know. Our Prime Minister announced the 81% reduction target at COP29. And we've recently published our carbon budget and delivery plan which sets out both how we're going to deliver the 2030 plan and the 2035 NDC. So both of them are in that. So we're very much moving into the implementation phase, and actually we're publishing a whole bunch of associated plans, and I'll just mention one in a moment that's really relevant to this conversation. So the ambition is there, but as the question is it helpful to take a more people-centered approach? And I think the answer is absolutely yes. And we really, this whole conversation is so helpful, and it's very much where the UK is at. People have to be at the heart of delivery, and this has to deliver tangible benefits for people. That's so important. When we came up with our NDC target, we discussed it with a range of stakeholders across the UK, including civil society, business, academia. And now as we're moving into delivery, we're doing the same thing again. We're working in partnership with businesses, trade unions, civil society, local government, to really get that effective public participation and action, and to really make sure that this is actually delivering in the spaces that resonate with people. And I mean, some of the health pieces that we've just been talking about, the air pollution, the co-benefits of more efficient land use, urban planning, the cleaner transport, all of that, and really articulating that in terms of tangible benefits for people for whom net zero doesn't necessarily translate into something that they can mobilize around, unless they're committed environmentalists, like of course we all are. So I think that is incredibly important, and health does feature in many ways, both directly and indirectly, in our NDC. We are going to be publishing a plan, as I trailed, later this year, for how we're going to support individuals and communities to take action and benefit from the transition, and that will certainly include health elements within it. So that plan is coming, and it will come off the back of these consultations and engagements that we've been doing. And we'll really make sure that within that we're working on those co-benefits, the green spaces, the cleaner transport, the tackling air pollution, and really tangible improvements in people's lives. So thank you.
Wonderful. Yeah. Thank you. Thanks very much. Just wanted to... I want to keep the speakers on their toes, so I've got another question. But promise just one more, and then I'm going to check back to see how much time I actually have. So Ventura, I want to come to you, because something that Anna mentioned was around stakeholder engagement across and subnational or local government engagement. So I'm quite keen to understand, how do you see implementation, how is it all coming together between local government, national and international agreements? And your thoughts on that as someone that's worked in implementing climate plans.
Thank you. I think we had some examples already from Guatemala, but what we're realizing is, one thing when all the partners, our executive secretary brought together last year, trying to understand how do we make the NDCs more informative, instructive and implementable. Mm-hmm. So how to improve the quality of the NDCs, because we don't want it to be another document that's been developed and put aside and we visit after another 5 years, but something that actually is owned by the countries. So it is important that from the start, that there is a policy cohesion, that what we do in terms of whether it is the energy planning for the country, whether it is the disaster risk reduction plans for the country that were being developed. Now we have the NBSAPs that are being developed under another convention. So all of these have coherence, and also what are national priorities, what are the national development priorities. These are actually reflected in these documents. As you know, by nature, it's supposed to be country-owned and meet the country circumstances, but it's also important that it is, while addressing climate change, it also addresses the national development priorities and sustainable development. And this policy coherence, we find, is one of the key factors in ensuring that there is a whole of government, whole of society engagement in the implementation of the NDC. And this has to start from the beginning, not after the NDC is developed by one ministry or the other, but all the ministries, all the stakeholders coming together from the beginning and being engaged would ensure the success of this. And in implementation, what you are realizing is, yes, it's no longer one climate change ministry or an environmental ministry who will be responsible for the implementation of the NDC. And as I mentioned before, about the success of the implementation also depends on how you manage the socio-economic impacts. We talk about just an orderly transition, that how you leave no one behind in this implementation of the NDC. So whether it is mitigation or adaptation that ensures that the socio-economic and environmental impacts are managed, how you maximize the benefits from the co-benefits, what we discussed, but also address the negative socio-economic impacts through co-policies and other measures is important for the success. So when we want to implement, it's not just the government actors, but also the private sector who would have a key role, as well as the civil society and the general public. And it's important that we do engage all these actors. And one of the things that we realize, like, it's talking about also a mindset change in the whole population that would be needed in order to implement, like, about how we consume. This all influence the success of delivering of the NDCs. And in order to that, like when you talk about the health sector, about the social, psychological aspects of that, they also play a key role in how you actually convince a society to transition into a low emission society that is adaptive to the climate change as well. So I think there's a wider role for different elements that you don't even think of normally, that you would associate what's being needed to be involved if you are to make a successful implementation of the NDCs. And we hope that this, and we see wide variety of actors in terms of the support organizations. Whole of the UN system, no? You see UNICEF, WHO, FAO, being part of UNCTAD, actually all seeing that there is a vital role, that all of these has to come together, even from the supporter side, when it is about accelerating implementation.
Great. Thank you. Please, please.
Thank you. I just wanted to add upon what you just mentioned, because for us, we actually started our process thinking about what's viable and feasible and looking into the NDC 2.0 and realizing why those goals weren't really achieved or whatever. So we started from there. And I think that's very important, because we have to make sure that it's something that a country can achieve and not just something like a document that we revisit every 5 years. And I think that's the spirit of it, because that's the cycle of it. But we have to change a lot of, it was a challenge to really going through the different sectors and ministries and all other involved and make that shift of like thinking, like it's not just a document. This is a national tool for us. This is a guidance for the country. And something very, very important that you mentioned is that is not under the Ministry of Environment or whatever the responsibility. This is something for the whole country. So that was something that we really emphasized a lot in our workshops. We're coordinating this, but remember the NDC is for all of us, and it's all of us. So we all have to commit into it. And that's why we're looking into really making sure that this is established in our budget. Because if you put money into it, then people's actually going to care and do it, because they're kind of obligated into it. So that's something that I see. I agree with everything you said, and it's a challenge to do all of that. But that's exactly our rationale behind the whole process. So I just wanted to add that can be done. It's hard, but it can be done.
No,
Yeah.
that's good. That's great. Thank you. So it's very much like a whole of society, whole of government, but also a sort of a whole international movement as well. I'm just conscious of time, so I do want to use this opportunity to open the floor for questions. We've got about 10 minutes before we can have some responses and then some concluding remarks. Please. Oh, mics will be provided for questions.
Hi, George Thurston, New York University School of Medicine. It's going in and out. Make sure that you're going to document the good things that are going to happen as these NDCs are implemented. In my own work, I've documented this, and actually we'll be talking about it at a session in the Health Pavilion, 9 o'clock come Monday morning. But for example, in India, where they bent the curve versus projected, looked at what was projected for the CO2 emissions, and we actually, what happened was they had much lower emissions, not going down, but went up less. And we looked at how much CO2 was reduced and then converted that into particulate matter and found that almost 250,000 lives were saved each year at a valuation of $5 billion. I mean, these victories are happening all the time, that we are making progress and saving lives, and we need to document these things and show, yes, we, yeah. Yeah, it was, I see. My hand was in the way. Up here, okay. It was, anyway. So are we gonna put in effort to document the good things that are happening instead of what most of the focus is on the bad things that will happen if we do nothing?
So we're going to, is that a question
Yeah, it's
for
a
anyone
question.
in particular? Or
Well, you know,
a country perspective?
for
or-
Ventura, I think.
Okay.
I think I spoke too much. Maybe, I don't know, maybe WHO or someone else want to respond to it. I mean, I agree, but
Yeah.
I think
Elena.
we all agree, yes. We will make sure that all this is documented and shared. And for example, we have a very good example with the Global Climate and Health Alliance and the scorecards that they do, where you can basically see in a snapshot, super visually, what is going well, in which country, which are champions. I think that's a nice resource, and we can do more, for example, to develop a case study.
Positive case studies and platforms for that. Ventura, did you want to add anything?
no, I mean, sorry. No, but I mean, I agree. Like, this is the importance. One, I mean, there's two aspects to this. One is about how do you, like, when you have these positive core benefits, one of the challenges is like who benefits from that, because it's one ministry who's implementing this, like maybe the energy ministry, but who's benefiting is going to be a health ministry. So how do you share this kind of good practices, like you know, the benefits from those? There should be some agreement and some mechanism within the government that needs to be implemented, so that will actually drive more work forward. And that is where I think, again, the question about like the cohesiveness in the implementation comes into being.
Absolutely. Absolutely. Please, Andrea.
Thank you. I just wanted to add maybe just from a perspective of a developing country, I believe this process of documenting the good, the bad, and every lesson learned is crucial because we do have this political unstable scenario. We do have a change of government very soon enough in our countries, and usually what happens is that they just start over. So this is crucial for countries like mine, because they're very vulnerable, and also we know that it's a long-term change, especially for adaptation. And in my country, it's every 4 years. In 4 years, you don't get to really see the results. And usually governments come and go and they change things. So this practice is crucial, but it needs to be backed up with some kind of institutional or framework or something that gives them that weight. So when the government changes, they don't really just don't care about those good lessons. So from a developing country, I think that practice should be something even more, the secretary, the convention should push more for that, because we do see that in our country, that people just start over. So,
Anna, would you like to come in, share any reflections?
No, I mean, I was just going to make a broader reflection, which is I think that's true across the board. I think it's definitely true for health, and I think it's true in general for climate action. We've got to get a lot better at describing the impact that we are having and where we're making progress, because there's always a lot further to go, but people lose motivation if they feel that they're not actually making progress on the things they're trying to tackle. And so I think figuring out what we want to measure and actually really selling it loud and telling people what impacts we're having is super important across the board. Yeah.
Absolutely. I'm going to... Oh, they're all coming up now. Okay. I'm going to take two more questions, if I may. I'm going to start with you over here. So if I could get a microphone, please.
Thank you. I'm Amanda McKee with the NDC Partnership. And this is really music to my ears. We've started a new collaboration with the Wellcome Trust, and we're already seeing countries come forward with requests for support through the partnership on the health sector. And I was looking at our data, and of about 100 countries, 55 have some sort of request on health that they've already put forward. So it's really positive. The thing that worries me is that there's only 35% of those requests have been supported. There's a huge gap in support. And my question to you on the panel is, where should we be looking for that support? What types of partners should we be trying to bring in and engage them in this NDC process to ensure that health isn't left behind?
Thank you. Can I ask anyone from the panel, or do you have someone in mind?
Is that a question for WHO?
WHO.
This is music to my ears also. Because, I mean, we've been in contact before, and we were trying to see whether there was a mechanism basically to support the health component of NDCs. So from WHO, we have the tools. We've been doing this for many years. We've been doing the assessments, and we've been supporting countries basically to integrate health within their NDCs. So we'll be happy to further discuss with you and assess again which are the possibilities to build a partnership that is really responding to the needs by countries. Yeah.
Absolutely. I think there's quite a nice partnership with UNFCCC as well here. So this is that international sort of collaborative effort. Last question. Thank you so much.
Hi, I'm Mary Rice from the Harvard Center for Climate Health and the Global Environment. All of you have spoken about the tremendous health benefits of mitigation action, and also about the need for good data at different levels. And I was struck by the WHO work on the tremendous number of lives saved from just 5 different types of actions. And I'm curious, I guess this is a question for Ventura, but potentially also Elena, about and really everyone on the panel, if we have time, about whether there's any effort to break down those metrics and perhaps include outcomes other than mortality, which sometimes I think is hard for people to get their head around, and thinking about that as an economic savings, for example, and bringing it down to the country level. What are the hospitalizations that could be saved from different types of climate actions, for example?
I think there's an answer to that because WHO has a data,
Then
I know the answer, but I will let WHO speak for it. Because it was work that, there is work that have been done. So the calculations have been actually the number of days, the work days that you lose due to being on sick. That had been calculated, mortality rate, of course, what you mentioned, but also the savings in the health sector, like from the amount of, I guess there was some counts on hospital bed, something that is saving, and also the saving on the health, the medicine and the healthcare sector in general has been also some of the indicators that had been counted in. But I know WHO had like a lot of other indicators that I cannot recall. I'm sure that you could help on.
So, well, any of these estimates is quite complex, and then I have my boss there. Maybe he wants to add something, if he wants. But I think your question is very good. Well, if data is available, we will be happy to look at that. And I provided an example also on, for example, productivity losses. That is looking more at illness and is looking to basically workers not being able to work, which means losses for enterprises. But I think that while you were making this point, I think I was reflecting also in the need to talk to other people, because we as health, and that's why I find it super powerful listening to Ventura talking about health, because the capacity that he has to reach to other sectors, and this whole of a government approach for the health sector is the same. It's not only the responsibility of the health sector to make sure that people are not ill. It's the responsibility of the Ministry of Environment, it's the responsibility of the Ministry of Energy Generation. So basically, this whole of a government approach should be implemented also to protect the health of the population. So again, the more we can have this data by the different sectors, now, for example, exposure to air pollution that we may have, and we have databases, but how it's linked to interventions and how we can save lives, and we have tools also to look at that. But again, I don't think we are able to produce those estimates in terms of illness at very lower level in a country. You want to say something, boss?
I'm getting it clear. You've answered that. You've answered that brilliantly as well. So I'd just like to take this opportunity. Apologies for having to close the Q&A, but to say thank you so much to the panelists. You've all just brought such a unique perspective and really taking home the whole of society, whole of government approach to implementation. I get the pleasure now of introducing Dr. Jenny Miller, who's the Executive Director of the Global Climate and Health Alliance, who's going to give us some concluding remarks, and I could go and sit down now.
Thank you so much, Arti, and thank you to the Wellcome Trust for putting together such an extraordinary event. You know, I'm coming out of this event feeling so inspired, and I think what every panelist has demonstrated and articulated so well is what a powerful argument there is for integrating work on health and work on climate change. I think we heard from Elena the why we want to do this, and then from Andrea and Ventura and Anna, some of the how that we can do this. The examples of the integration of work across ministries are just so powerful. And then working with stakeholders beyond government to ensure that you're bringing the public along with you, again, is so powerful. And then thinking about one of the things that's always been so striking to me about the NDC specifically as a mechanism is that they are the tool, or one of the tools, that makes the link between work at the national level and work at the multilateral level. So NDCs are a multilaterally developed tool, but every country develops its own NDC and designs it how it wants to, and then implements it how it wants to. So it really makes that connection between the commitments that are made here at the COPs and what happens on the ground in country. I'll take the opening that Elena gave me to mention the Global Climate and Health Alliance and explain the Healthy NDC scorecard. So we, several years ago with the NDCs 2.0, conducted an analysis of the NDCs and looked at exactly their integration of health and to what extent every NDC was integrating health in its kind of every aspect of what it designed. I think we came up with the idea for that because we had in mind some healthy competition. So we actually score countries and compare them with one another. But the other thing that we found through this is that there is incredible opportunity for inspiration from country to country. So the examples of that Guatemala and the UK have shared can serve as inspiration to other countries for how to do this. So just to kind of wrap this up and conclude, these latest NDCs bring us closer to achieving the Paris Agreement target. We're aiming to limit warming to below 2.0, ideally to 1.5. The ratchet mechanism of the NDCs, where each round of NDCs is meant to become more ambitious, that's working. Each NDC round has been more ambitious, but we're not quite there yet. We're not at the point where our commitments are getting us to the targets of the Paris Agreement. What I think we heard on this panel is that there is ample reason to be even more ambitious than the commitments that have been made. So they are not the ceiling for what countries should be doing, but actually the floor, the basis, and you can do more, and your own populations will benefit, your economies will benefit, your society will benefit. So I think with that, I just want to say thank you to our panelists. This really was an extraordinarily inspiring panel. I see so much reason for hope in what we heard today. And thank you to everyone who joined us for this.